Today brings news of death, but importantly, it's preventable death. Sudan has an outbreak of measles. South Sudan is facing a spike in cholera deaths, and a report from Guinea says tens of thousands of malaria cases are going untreated because of Ebola fears. All three of these deadly situations have one thing in common: they are treatable. In the case of malaria, a new study says more people died in Guinea and West Africa from malaria in 2014 than during the entire Ebola crisis. Check that, more people died from malaria than Ebola. And this year it will be even worse. The Ebola crisis has kept people infected with malaria away from health centers, meaning even more people will probably die. Remember, malaria is treatable. Cholera is another highly treatable condition. Most people afflicted can be cured simply by intense rehydration. And yet, 18 people have died in the last 3 weeks in war-torn South Sudan. While in neighboring Sudan, over 2,500 people have been diagnosed with measles, and 38 people have died already this year. Measles can be prevented through a vaccine, and still people, mostly children, are sick and dying. These three situations feature diseases that are all treatable and preventable. These deaths can be stopped. Join Global Citizen to take action to improve health systems and stop these preventable deaths. That's your Global 60.